Hi, this is the Emoji Pharmacist. This video is going to be about why you can't get your narcotic pain medication filled. In a nutshell, each pharmacy has limits placed on the amount of medications they can carry. The limits vary product to product. For instance, you have morphine products are limited to, at least in my pharmacy that fills about 1,300 prescriptions a week, we're limited to 1,200 tablets a month, which allows us to fill for about 16 patients a month. So we can only hold those for established customers. And these limits have been placed on all medications. They were set at the first of the month, so by the end of the month you've usually met those limits. This means that we're in a situation where if a cancer patient comes in and they need the medication, we honestly don't have it for them, and they wonder why and why we can't just order it, and it's because of these limits that are set up, and there's no way around it. So a lot of these pain medications are taken up by chronic pain patients that come every month that have been there, coming there for years, and they fill a lot of other medications there. So, from a business standpoint, you have to hold the medications for them. The consequence is you won't have it for a new customer that really honestly does need it. So we're in a really bad scenario where if you do fill it for that cancer patient, you won't have it for a regular patient. Then they'll leave, and then you'll lose business for making that decision. So you're in a kind of a catch-22 of choosing business over serving a customer that you honestly know does need it. Now, when a pharmacist tells you that they don't have it, and you're thinking they do, they just don't want to fill it. Well, they may actually have it, but because of that decision that they have to hold it, because of the limits, then it's kind of like a half lie, half truth. Now, if a pharmacy tells you to transfer all your medicines in, that they'll carry it for you, that's also because the amount of controls that you get, to get that limit increased, you have to fill more non-controls, basically have higher volume, and then in doing that you can have a higher limit on your narcotic medications, and that's why a pharmacy will require you to fill all your medicine there in order to get the narcotic med. So if you want to stay grandfathered in, if you want to keep your spot, it's important that you fill your non-control medications on time every month, and that will ensure that the pharmacy keeps their limits high enough so that they can have the medication for you every month. I don't know how to fix this situation. I don't agree with the limits that are set. I understand why they're doing it, but the consequences are that there are people out there that really need it that can't get it, and I think that that decision should be left up to the pharmacist. When you put limits on, it makes us make a decision that we don't necessarily want to make, and there may be situations where we turn down people that we know really need it, or we have patients that come every month and then we don't have it for them because of these limits that we hit. Longer months like January where there's 31 days, that means you have to have a whole extra day without having the medication. And then shorter months, you get the medication sooner, like in February when the limit resets in March, you'll have it again. So some myths and some truths about narcotic medications. My pharmacist just doesn't want to fill it for me. Yes, there are some pharmacists that are like that just don't like dealing with those medications, and I can kind of understand that because it is a risk. About 6 to 7 people die every day from opioid, and this isn't even like abuse illegally. This is people using it as prescribed, and they need higher doses because it has a tolerance that builds up, and they end up just stop breathing during the night. Maybe because of other medications they're taking with it, maybe not. So there is a risk with it, and some pharmacists just don't feel comfortable. And I understand that some people actually do need it, and I look at it from a different standpoint. I try not to be judgmental about it, and I'm pretty open-minded. I do think there's better options out there for pain, but I don't want to talk about that in this video. I just wanted to talk about why you can't get your pain medication. If you guys have any questions, you can ask in the comment section. I'll try to answer them as fast as possible.